Hi, in this video I'm going to highlight a non-surgical glaucoma problem about which we're all generally aware, yet I see increasingly in practice. Prostaglandin agonists revolutionized the management of glaucoma in the late 1990s, and we're all aware that occasionally they can cause macular edema in patients such as aphakics. However, it still surprises me how often I get referred patients with chronic intractable macular edema who are about to have a steroid implant such as Ozurdex or Iluvien, and the surgeon is worried that the pressure is going to go out of control, yet the patient is still on Lumigan or Xalatan. It's obviously very difficult to differentiate the relative contribution of the drug and the disease to the macular edema in eyes such as uveitis. So in this video, I'm going to briefly show two much less complex cases just to highlight the potential for prostaglandin agonists to cause macular edema. I do hope you find this useful. Hello, the two patients I'm about to present recently reminded me how potent prostaglandins can be in the causation of macular edema, and this is particularly relevant in patients such as uveitis who may have intractable macular edema and a pressure problem, and it can be difficult to control the pressure without prostaglandins, but they may be contributing to the macular edema. This macular OCT is from an 85-year-old patient on no glaucoma medication in February 2021. This is the same macula 9 months later and 5 months after starting latanoprost for IOP elevation. One month after latanoprost withdrawal and topical nonsteroidal treatment, the macula is almost back to normal. Here is a second patient, an 80-year-old patient with a visual acuity of 6.6 and a pressure of 25 mm mercury before starting latanoprost. 6 months later, the visual acuity is reduced to 6.12, best corrected, and this is the macular OCT. Two months later, on Macular and Cosopt after latanoprost withdrawal, the visual acuity is 6.6 again, and the macula is normal. I think these cases serve to remind us that we must be cautious with prostaglandin usage in patients who have macular edema if they can cause macular edema in patients who have had no previous macular problems. Thank you for watching. I hope you find this a useful reminder.